lot of people don't even know that there's screening for lung cancer. And if they heard about it, they don't know, the benefits of it, and they don't know, when they would qualify to be screened for lung cancer. A lot of people who quit smoking, they think they're no longer at risk and they don't need to be screened. And we know that people who quit smoking, they meet the age criteria and the amount of smoking, they're eligible for screening for 15 years, after they quit smoking. It is important for high-risk patients to be screened for lung cancers for multiple reasons. Obviously, lung cancer kills more people than any other cancer. And lung cancer shows symptoms only after it has spread out, which makes it very challenging to treat. Nationwide, studies have shown that only about 13% of eligible populations are being screened for lung cancer. Those numbers, unfortunately, are a lot worse in the South, such as in Georgia, which the number is about 6% only. This is even worse when it comes to more rural or medically underserved areas. People who should be screened for lung cancers are those who are considered high risk for lung cancer, and those are usually population between the age of 50 and 80 who has what we call 20-pack year history of smoking, and that applies to current smoker or former smoker who have quit within the last 15 years. And low-dose CT scan is a special type of CT scan that utilizes a much lower amount of radiation than a standard or regular CT scan. It has a thin cut sectional cuts throughout the lung top to bottom that will help us identify the smallest lung nodules and other abnormalities that usually will not show on a regular X-ray but would show on the special CT scan. And the low-dose CT scan is a very simple test. It takes only about a minute to complete, and it's non-invasive, and it's quick and simple, and it's painless. And usually people who meet this criteria have to be screened every year with this low-dose CT scan if they are between the age of 50 and 80 and meet the smoking criteria, or if they've quit smoking 15 years later, they no longer need to be screened. Of course, you gotta keep in mind that those are the current guidelines and things evolve and could change over time.